Dear colleagues, welcome to the ITI Global Webinar Series. My name is Irena. I'm the head of the Division of Fixed Prosthodontics and Biomaterials at the University of Geneva. And I would like to thank the ITI for inviting me to give this webinar to you. It's a new project by the ITI, a very active global community in implantology. And I'm happy to give you a little bit of an insight into restorative dentistry in the era of digitalization. A lot has changed over the years, and I think we need to get maybe first a glance on what is our ultimate goal as restorative dentists. Well, if you look into this patient situation, it's not an implant-supported patient situation, it's a dental, I would say, reconstruction that had to be done here, a full mouth rehabilitation, on a patient who suffered from bulimia for many years, and who was treated by one of our faculty members, a specialist in reconstructive dentistry. And you can see that this patient has received a full mouth adhesive, minimally invasive rehabilitation by Dr. Strasding, and you can see the patient smile after this treatment. If you compare the portrait on the left and the portrait on the right, you can observe that this part of our dentistry, restoring patients, I would say, rehabilitating patients' dentitions, is not only changing patients' function and dental aesthetic, but it's changing patient lives. And if you can see how this lady has developed over the years, you can see the raise in self-esteem in her facial expression. Does this only apply to this type of patients? Well, no, because if we look at this case, for example, an elderly gentleman who was a little bit anxious about dental treatments, so he was avoiding to go to the dentist.